So I've had a lot of people ask me, why didn't you give your newborn child the vitamin K shot? And I wanted to give you my health perspective and also my conspiracy theorist perspective on this to answer this properly. So the vitamin K shot has been more prophylactically used as a standard practice since the 1960s. And it wasn't until the 1930s that it was identified that there is a vitamin K deficiency bleeding problem that can happen in newborns, though it can be pretty rare. Oftentimes what will happen is, you have your baby, it's born, and they'll cut the cord right away. Well, if you haven't heard already, there's this process known as delayed cord clamping where you simply delay it, 7 to 15 minutes so that you can allow for a better transfer of nutrients from the mother to the baby. And oftentimes we'll be getting things like iron and vitamin K. And so I think one of the big problems that started to arise in my mind, a big red flag that popped up was, well, why don't we delay cord clamping more? And why are we so quick to cut the cord? Well, you'd be kind of surprised, maybe not so surprised to find out that in the 1980s and 90s, they started to collect a lot of the blood from the umbilical cord, and they can use that blood and use it for stem cell production. Now, you can't actually sell the blood, but it can be donated to banks, and then the banks and businesses like that can sell that blood and those stem cells for a lot of money. There's some research that I found, it's anywhere from $25,000 to $50,000. Now, don't quote me on that, but that's just what I found. And so that's where I started to get even more concerned that, hey, maybe it's okay to follow this God-given process for a healthy mother who's not taking any anticoagulant medications while she's pregnant. Maybe she is able to have normal breastfeeding and able to feed her child normally, and there's no complications. Maybe it would be okay for my child not to get this synthetic injection that is full of these other materials that I'm not a big fan of injecting in my newborn baby. And so that's why my wife decided to do that. Now, I'm not...
Okay, so first of all, the guy is totally out to lunch on what he's saying. Number one, there's absolutely no evidence whatsoever in the scientific literature that delayed cord clamping, which we do routinely for all newborn babies, has any impact on the vitamin K levels. None. Scientifically unfound. Not true. There is no evidence for that whatsoever. Number two, many babies are born vitamin K deficient, and they are at very high risk of neonatal stroke, people. That's the baby having a stroke. Even if it's something simple like a circumcision, 600% increase in bleeding complications if your baby doesn't get vitamin K and you're doing something as simple as a circumcision, okay? So there are huge bleeding risks for babies when they are newborn because they are deficient in vitamin K. The whole stem cell thing, that's insane. You can't take people's cord blood and just sell it. They've got to consent to the process. You can't just take off with it and have some